Hello. All right. So let us continue the Nash therapeutics study streak. And so far, we have discussed some acids which are required in cases where there is typhoid or struggle which is going on, long periods of disease, and then the patient reports to us. Or the disease has acted too fast to cause lot of damage. But there will be cases where we will see that a similar picture like acid, but the sphere of action of the disease is different. That's where we should think of remedies which are very similar acting on the human body like acids, but similarly deeper or in a different plane like the remedies which Dr. Nash mentions, carboanivalis, gelsemium, and bacteria. So let us study those remedies from Dr. Nash's therapeutics. And good to see some people joining Mahi 2004, Yogitha, Dr. Refi, Ajnis, and a few people on YouTube. So carboanivalis is a small remedy mentioned by Dr. Nash, almost a half a page or one page, we should say. And he tells that there is great weakness, want of energy, and prostration in this remedy or in the patient. The seat of affection is glandular swellings, indurations, suppurations. So, all those cases that we see, swellings are involved, and some sort of weakness accompanies the swellings. It can be lymph node swelling. Lot of children, lot of adults will report to you with complaints of lymphatic gland swellings in the axilla, in the abdomen, mesenteric glands, inguinal glands. And if there is a lot of weakness, generalized weakness, carboanimal should be the remedy that we should think of. So it is a remedy Dr. Nash tells us is good for benign suppurations which are enclosed in a circle, just like how lymphatics are. And if they burst or if they are wounds or ulcerous in nature, then there would be inclined to become ichorous. Ichorous is some fluid that oozes out of ulcers, which is foul smelling or not good in consistency. So that is the sphere of action and the entire disease process of carboanimalis. The swellings can become hardened, which Dr. Nash tells us, and it can be anywhere, like I said, axillary, inguinal, mammary, etc. The remedy also acts on sexual organs, and there is menorrhagia from chronic induration of uterus. So when we see these words that there is menorrhagia from chronic induration of the uterus, we should directly connect it to how we will be seeing it in the present scenario. And how we will see it, the patient will have fibroids since the last 1 or 2 years. It's detected maybe 6 months ago or 1 year ago, and there is lot of bleeding which is excess in quantity than what the patient normally experiences in her menstrual cycle. So that will be the presentation clinically of this particular symptom, which is menorrhagia from chronic induration of uterus. There are indurations, swellings in the uterus, which are fibroid, and the patient is having excess of bleeding, and the patient is weak in appearance, or tells you that weakness is a subjective symptom, and the flow kind of weakens the patient. There are nodules in the breast, or patient tells you that few years ago I had got operated for fibroadenomas. So that is the perfect recipe for carboanimelis in the clinical picture in the 2025. Next remedy, what Dr. Nash tells us, is gelsemium, and it acts on nervous system. We all know there is complete relaxation and prostration of the whole muscular system with almost or quite entire motor paralysis. And then he gives us an entire chart, a flow chart which he has prepared in a textual form, that there is in gelsemium inability of the nerves to convey the impressions what have been told by the mind, and that's why we say there is muscles which refuse to obey the will, and that's why we say also as an accompaniment there is a symptom which is lassitude or fatigue. The patient becomes lassitude not only on the physical level but also in the micromolecular level, which is the pulse, or the smaller things in the body become slow and weak. And as soon as the patient starts walking or does any activity, it is accelerated and he fears. If the patient does walk, the legs tremble, tongue is weak, they can't speak, and this symptom can become objective and subjective, and that is why Dr. Nash tells gelsemium as a trembling remedy. So, gelsemium is a remedy he explains in 4 to 5 pages, and I put it on 3 slides. For those who are watching on YouTube, you will be able to see the slides presentation and some information condensed from Dr. Nash's therapeutics. And the sensorium becomes clear, but there is drowsiness, which is what happens in gelsemium. Neuralgia is there in various parts. It can be local part, it can be general parts, and there is starting, which is getting aggravated by least activities in the surrounding atmosphere or surrounding area, and there is prostration. It's a nerve remedy. The gelsemium subject is torpid, which means that they are very sluggish in movement, they are very sleepy, and they dread movement. The mental faculties are dull, cannot think clearly or fix his attention. Susceptibility to mental disturbance such as sudden excitement or emotion, bad news, fright, anticipation of unusual odor, and this is the reason why diarrhea happens. So you see that in gelsemium, and we have discussed this in the remedy picric acid as well, that the weakness of picric acid is at the level of mind only. They just cannot focus well, and there is mental exhaustion, or there can be some physical exhaustion, which will be just a generalized picture. But in gelsemium, due to the emotional disturbance or the turbulence, which we should mostly assign the term, there would be localization of the problem on the gastric sphere, and that's why diarrhea happens. And Dr. Nash tells us that gelsemium not only cures diarrhea but the whole abnormal condition, and it helps in the 30th potency. He has used all the potencies, but 30th is what he claims. Next, he moves on further to other parts of the body where gelsemium acts, and that is the dizziness, the eye symptom, the dizziness with the blurred vision, and the pupils are dilated, there is double vision and sense of intoxication. Child starts as soon as the nurse clings or is about to put the child to the crib, the patient fears as if afraid of falling. So Dr. Nash gives us one line of differentiation for gelsemium and borax, and that is gelsemium grasps before falling. Even before the act of putting in the crib or going downwards, gelsemium fears, and that's why he clings. Whereas borax will grasp in the process of being laid down. So before the laying down process, it will be normal. But as soon as the process of laying down happens, the child starts crying. So if you understand these things, it will become easier for you to prescribe borax or gelsemium in the clinical practice by asking the same question to the patient. Headache is better by profuse flow of urine, which is also there in lac defloratum. And most of the migraine cases, as an acute, will be helped by lac defloratum or gelsemium. So lac defloratum and gelsemium will have the similar symptom of accompaniment of urine with the headache, but lac defloratum will not feel better by the flow of urine, whereas gelsemium will feel better by the flow of urine. And then you will see that blindness starts or the dim vision starts before the headache begins. We saw this also in the remedy Kali bichromicum. In iris versicolor, the blindness happens after the headache starts. Whereas in Kali bichromicum and gelsemium, you will see that the blindness starts before the headache has started. And as soon as the headache starts in gelsemium, the blindness disappears. The patient starts to feel better in the vision, but the headache persists. So if you have these landmarks made for certain remedies, you will be in a better position to prescribe for all the different migraine cases. Otherwise, everything will look similar and you will give one remedy after the other and palliate the case. Also in iris and sanguinaria, Dr. Nash tells, and also we will clinically see that there will be accompaniment of nausea and vomiting. There may or may not be the element of visual disturbance in headaches, but there will be nausea or vomiting mostly accompanying the headache. But gelsemium has the blindness and also Kali bichromicum. Next, what Dr. Nash tells us, and this is the last part, where he tells about how gelsemium is useful in fevers. And you will see that the patient is drowsy, as we saw in the mind explanation from Dr. Nash, and there is a kind of a mild fever form. He tells us that one of the authors quotes that gelsemium is somewhere in between aconite and veratrum. But Nash tells us that he places gelsemium between Baptisia and belladonna. So Baptisia is kind of a slow, very, very, very slow, dull remedy or delirious remedy. Offensive fluids, offensive discharges, offensive breath, offensive odor. And belladonna is on the extreme polarity, which is violence, acute, congestive, etc. etc. So between these two parameters lie gelsemium for Dr. Nash. So if you have been seeing different patients and different remedies you have prescribed, You will understand what it means to classify remedies in between each other or differentiate from the other remedies. And then Dr. Nash goes on to explain about the nervous chill of gelsemium, and he compares it with eupatorium, natramur, capsicum, sepia lachesis. Now, I have taken this entire explanation of different types of chill, beginning of chill, the fever stages, what to do in fever, how to give medicines in fever, when to use which remedy in detail in the fever workshop, and I'm collecting the videos to put up together for everyone to watch. So if you are stayed following with Homeosetu YouTube channel, Facebook, or Instagram, you will soon get the information of how you can avail the recordings. But to make it a little bit theoretical, you can go and read in Dr. Nash's book about how and where the chill begins. Sometimes the patient will be able to tell you, sometimes he will not be able to tell you. So when he is not able to tell you, we will be able to find out the characteristic symptom in other area of the patient, and we cannot stick to that point. Last but not the least, he tells us that since gelsemium has a kind of a nervous chill, the patient wants to be held, and this will especially be seen in hysterical cases or in heart diseases. So, there is no conclusive report which points out to some disease in the patient when the patient has chills or fevers, but still the chilliness persists. In such cases, you can think of gelsemium as a remedy. And little bit more about gelsemium is also discussed in the fever workshop which I undertook, and I'll put up the recordings for those who wish to watch. So last remedy for today which we should discuss because it is in sync with the previous two remedies, which is carboanimalis and gelsemium, and the remedy is baptisia. It is just a one page remedy. You will find lots of pages of this remedy in other books, but Dr. Nash gives it in its entire summary in one page, and he tells us that this remedy comes in to use after gelsemium or a state after gelsemium. So, what is the stage? The first stage is of nervousness, chilliness, aching pain, and soreness. The second stage is weak drowsiness, frustration, confused, suffused, sensorium blunted. So patient looks besotted or he appears to be, totally swollen with lot of fluids and drowsy, sluggish, and is very dull. And the third stage, what Dr. Nash tells us, is where what we will look for bacteria is where the tongue is streaked or the patient is in delirium. So the disease condition has progressed from nervous chilliness, aching pain, soreness to the deeper parts of the physical realm, which is the delirious state and the tossing to and fro or getting restless because of some vague thoughts trying to scatter himself. This is what we read in our classical books. And the fourth stage, what Dr. Nash tells us, where we will see baptisia, is the bowels rumble, and there is ileocecal region or the lower abdomen which is sensitive to touch, and the general discharges become offensive. It can be breath, it can be nasal breath, mouth odor, the discharges, the perspiration, the stools, the urine, everything. So Dr. Nash tells us that this is like a specific remedy for typhoid cases he used to give. In today's age, homeopaths get very less chance to cure typhoid because the patient has immediately rushed to the nearest super consultant. But he tells us that this remedy, baptisia, was given by him in all the different stages. We shared about four stages: one, two, three, four. In any stage, he has given baptisia and it has cured. He cured a case of fever typhoid fever, which was persisting for 7 years, and that got cured with uh, baptisia. And he has used the remedy in all potencies. So that's where he concludes the talk of baptisia, and also we conclude our talk on carboanimalis, gelsemium, and baptisia. Those who are following Homeosetu YouTube, WhatsApp channel, Instagram, Facebook. Stay tuned for interesting learning in 2025.